I'm Rebecca.
And I'm Lizzie.
And we're the chief residents here at Middlesex Health.
Let's go on a tour today.
Come on with us. Welcome to Middlesex Hospital. Middlesex is a 275-bed, independent, not-for-profit community hospital. We're the only hospital in Middlesex County. We have several important designations that we're really proud of. Magnet Nursing, Most Wired, LGBTQ+ Health Equity Leader, among others.
We are the only residents here at Middlesex and have close collaborative relationships with all of our specialists. Family medicine itself is well respected within the health system and the community.
Hi, I'm Heather. I'm a resident of the East Hampton office.
I'm Ophelia, and I am a resident at the Portland office.
I'm Suleiman, and I'm a resident here at the Middleton office.
The office experience is at the core of our work as family physicians and is a key part of every resident's education. Our practice has 3 offices in 3 different communities, which operate as a single practice.
Our Middletown office is on the hospital campus. It is our largest office and cares for a racially, ethnically, and socioeconomically diverse population. Our Portland office is about 10 minutes from the hospital on the other side of the Connecticut River. This office cares for a lot of young families in a suburban residential community.
Our 3rd office is in East Hampton, Connecticut. East Hampton is about 10 minutes further down the road from our Portland office. The East Hampton office is the only primary care office in this town, and we take care of both suburban families as well as a more rural population.
Residents are based in one of these 3 offices, but do spend time rotating in the others. No matter which office you are in, residents and faculty quickly believe that their office is the best. Residents spend about 1/3 of their total time during their training working in the office. We put a lot of emphasis on continuity of care.
Residents are assigned a panel of about 150 patients on their first day, and over the course of residency, that panel grows to over 400. Our residents provide care for their panel of patients when they're sick and when they're well in a variety of settings. Predominantly, this is in the office, but we also provide care for patients in the hospital, nursing homes, assisted living facilities, group homes, and inpatient homes.
Hi everyone, I'm Todd.
And I'm Cheyenne.
And welcome to our emergency department.
We're down in our emergency room at the main hospital in Middletown. Besides this ER, we have 2 satellite emergency rooms meant to improve access to our patients who live in the further areas of our county. This is a 29-bed emergency room and the 2nd busiest emergency room in the state of Connecticut.
Besides coming here to admit our family medicine patients, we do a rotation here during our 4th year where we work one-on-one with the emergency room physicians. What's nice about Middlesex Health is that we are a small community hospital, which means we know the community that we serve very well. We are not a trauma center or tertiary care, but we have major hospitals just north and south of us who are able to provide tertiary care services.
This is our critical care unit, which houses both our ICU and IMCU step-down units. We care for our own patients unless they require intubation or vasopressors.
In 2nd year, we do a rotation with the intensivist team, sit in on multidisciplinary rounds, and have the opportunity to do procedures like intubation, central lines, chest tubes, and point-of-care ultrasound.
Hi, I'm Heather.
And I'm Rebecca. This is an example of one of our medical floors.
Each floor has something unique about it. We have areas for oncology, telemetry, post-operative surgical, orthopedics, and general medicine.
Our hospital is special in that it also has a dedicated hospice and palliative floor. On that floor, it's a quiet unit where there are no overhead pages, and we are able to provide inpatient hospice services when needed.
Middlesex Hospital also has an inpatient psychiatric unit. We co-manage patients that are admitted to that floor when a patient has medical needs above and beyond their psychiatric care. We are fortunate that we can and do follow our patients all around the hospital.
As the only residents in the hospital, we are the first response team for any urgent or emergent situations that include rapid responses or codes that occur for any admitted patient. We work closely with our own family medicine attending as well as the hospitalists and all consulting specialties. Here's a typical patient room. We have a few shared rooms, but most are single occupancy. Some even have nice views of the Connecticut River.
Welcome to the Pregnancy and Birth Center. Our hospital does just over 1,000 deliveries per year, where we deliver babies over 34 weeks gestation. We have birthing people stay in the same room for the entire labor, delivery, and postpartum periods.
As a baby-friendly hospital, we have babies rooming in with their families, and physicians, nurses, and lactation consultants that provide lots of support for breast or chest-feeding parents.
Our labor nurses are fantastic, and they provide a ton of support throughout the labor process, helping us take care of our birthing patients. They are an essential part of our team in helping to make sure that birthing parents are comfortable, that they feel confident in their labor, and that we have a safe, collaborative delivery.
Here's one of our pregnancy and newborn care rooms. While well babies room in, there's a special care nursery where we take care of babies who need a little extra level of care, which includes our babies who have neonatal abstinence syndrome.
Residents participate in neonatal resuscitation in the OR during C-sections and perform hospital newborn procedures like frenotomies and circumcisions.
Here is our newly built wellness lounge for all staff to use. It's a nice place to take a breather and use the massage chair.
Welcome to our cafeteria, where we have many food choices. Residents get a discount, so it's very affordable, and we have a monthly stipend that can be used in the cafeteria or gift shop.
Come on in. This is our resident call room. This is a designated resident space where we can do our work, round, or relax with some TV and snacks. A lot of people will come here for lunch when they're in the hospital or even in the clinic in Middletown, just to spend some time together.
So this concludes our tour of Middlesex. We hope you enjoyed it, and if you have any questions, please don't hesitate to reach out.
You can also find us on Facebook and Instagram.